All right, it's 12 o'clock. We are going to go ahead and get started, but I'd like to start with some housekeeping first. The first thing is we ask that you stay on mute throughout the presentation, but if you have a question, you can put it in the chat box and we'll answer it at the end. And I'd like to thank you all for joining us today. My name is Paula Davis. I am the clinical director at Catholic Charities, and I'm also an adjunct instructor at the LSU School of Social Work. So today we're going to be talking about self-care in the time of social distancing for healthcare workers. We have a lot of information and we're hoping that you'll be able to develop some practical strategies as you take care of yourself during this difficult time. Okay, next slide, Stephanie. So the first thing is motivation. Whenever I think about doing the work that we do, I think it's important to look at our motivation. And for people who are in the healthcare profession, oftentimes they're motivated by a desire to help, but even more specifically, a desire to save lives. So the question is, how do you stay motivated when you are surrounded by so much death and suffering? So one thing might be to redefine for yourself how you define success. So in the past, success might have been saving a life, but now success might be being with someone in a time of suffering. And then also celebrating little wins. When we watch the news and we see the healthcare workers celebrating as someone is discharged from the hospital, we know that those celebrations are just as much for the healthcare workers as they are for the person who is being discharged from the hospital. Okay. Next slide, Stephanie. So I want to talk a little bit about the impact of trauma on the 5 Bs. And the 5 Bs are the brain, the body, our beliefs, our biology, and our behavior. So the first is our brain. We know that trauma changes the brain. And we know, especially in young children, trauma can even rewire the brain. But when we're under stress, when we're under pressure, it may take us longer to process information. And that's really important to keep in mind when we're interacting with each other. Also, we may have trouble concentrating because of being under stress and being under trauma. Trauma also changes our body. So you guys have probably heard about the ACEs study. And what we know is that for people who have experienced adverse childhood experiences, things like parental divorce, child neglect, abuse, parents who've used alcohol or drugs, that they are more likely to have negative health outcomes as adults, things like hypertension, high blood pressure, and heart disease. So we know that trauma can also change our body, but trauma also changes our beliefs and our beliefs about ourselves and our beliefs about the world. So this current pandemic is really confronting us with how do we see the world? Do we see the world as no longer being safe, but also how we see ourselves? So in the past, you might have thought, oh, I'm a strong person, I can handle this. But if you're struggling at this time, you might be thinking, what's wrong with me? Why am I having difficulty? So trauma really can shatter our view of ourselves as well. We know that trauma changes our biology. So one of the challenges when we're under stress is that it's important that we eat small meals throughout the day and healthy and non-processed foods, so that we maintain a level blood sugar. But how do you do that when you're working in the hospital and you're having to wear the PPE? We know that when we're under stress, we're more sensitive to dehydration. But how do you get water when there's no place for you to sip from? So we recognize that some of the things that we talk about in order to take care of yourself might not be available to you during this time. So we would encourage you to be really intentional about getting water in and eating healthy non-processed foods throughout the day when you're not at work. And then lastly, trauma changes our behavior. So we talk about the fight, flight, or freeze response. So for some people, when they're under stress, they may fight, they may lash out. Others may flee. So that flee could be a physical flee, or it could also be a mental flee, like they're fleeing and not paying attention, not engaged. And some people freeze. So for people who freeze, that looks like maybe they have trouble doing anything. They might stay stuck. And for people who are in healthcare, typically they're used to working in high stress environments, but people around you might not be. So while you might be in a fight response when you're under stress because you have to keep going, your adrenaline's pumping, you've got to take care of everything that you've got to take care of. When you get home, the people that are surrounding you maybe are not in that same place. They might be more likely to freeze or they might flee, but to be aware of how trauma might impact them as well. Okay, next up, slides. So I really like this graphic. It's the old brain versus the new brain. And when I'm talking to parents, oftentimes I talk about upstairs brain versus downstairs brain. So the downstairs brain is the old brain. The upstairs brain is the new brain. In our downstairs brain, we have our fight, flight, or freeze response. It's focused on survival, and also it responds to stress or perceived threats. And it's really reactive. And when you think about it, part of the reason why it's reactive is when our ancestors were being attacked, they didn't have a whole lot of time to think about options. They just needed to get out of there, or they needed to play dead. So it's a very reactive system. The new brain, which is the more mammalian human part of our brain, is the part of our brain that is responsible for thinking, for reasoning, for abstract thinking, for being flexible. It's also the part of our brain that's responsible for emotional regulation and for empathy. So when we're under stress or under what we would consider to be a threat, we're operating from a place of our old brain. So what that means is that the new part of our brain is not accessible to us. It's offline. So if you think about it like a printer, if your printer is out of paper, you pushing print over and over again is not going to bring that printer back online. It's not going to make you actually have something printed. What you need to do is to do something to bring that printer back online. So the way that you would bring the new part of your brain back online is things like skin-to-skin contact. You might notice when someone tells you a horrific story that you might automatically clutch your hand over your heart and then put your other hand over it. That is almost as if you were intuitively trying to calm yourself down. But skin-to-skin contact is one of the ways that we can bring our new brain back online. Another way is by deep breathing. So if we take a deep breath in, and let it out, that's another way that we can start to engage our new brain. So when we're able to calm the physiological symptoms of stress, we're able to calm the psychological symptoms of stress. So I've talked about skin-to-skin contact. I've talked about deep breathing. Also, touch with other people is another way to help bring their brains back online. So if you're interacting with someone and they're operating from their downstairs brain rather than their upstairs brain, you can bring them back online by doing some of those things. Another thing that you can do is connect with them emotionally. So, you know, if they're feeling frightened, to acknowledge that they're frightened. You might have noticed that when someone is in that place, if you try to reason with them, it does not work because that part of their brain is not accessible to them. So thinking about how you can connect with them emotionally. And then right now, one of the things too that we would encourage you to do is something we call shadow touch. So shadow touch is like actual touch, but you don't actually touch someone. Especially right now, we're not supposed to get that close to each other. But let's say a loved one or a coworker is operating from a place of being what we call their lid is flipped. So they're in their old brain or their downstairs brain. If you put your arm around them without actually touching them, that's just as effective as actually touching them. But that is a way to get a person back into the more rational reasoning part of their brain. I also notice during this time that we may be less flexible. You know, you might find that you want to hyper control everything. You might also find that you have less empathy for others. And again, it's because we're operating from our downstairs brain, or the older part of our brain, rather than the new part of our brain. Okay, next slide. So how is COVID different from previous disasters? Well, one thing, and this is true of all disasters, one of the things that we see is that substance use, especially alcohol use, increases. I was laughing the other day. I went to the grocery store and I'd bought some sparkling apple cider for a recipe that I was making. And the checkout lady was wondering how come it wasn't asking me my age. She did not recognize that what I purchased was not alcohol, because so much of what she has been selling has been alcohol. But just to recognize that substance use increases during times like this. So that, I think, is common to all disasters. And one of the things that is different for this disaster is this idea that we cannot come together like we have in the past. So during the floods, everybody came together and worked side by side to help recovery. Right now, we're not able to do that because of social distancing. Another difference that is, we're not able to connect with loved ones because of social distancing. So we might have parents or family members that we're not able to connect with physically because of social distancing guidelines. I think about the fact that this scope and scale of this pandemic has been so severe. For people who are working in a hospital, there's no break. We've been under the stay-at-home order for 2 months now. Previous disasters, they have not been this intense for this long. So people are getting worn out. And then when they go home, they're also having to deal with the social distancing at home. And then we also have the issue of a lack of shortage of safety equipment for our healthcare workers. And that too is another challenge. So thinking about how you can take care of yourself in this difficult time. And even ways that you might have taken care of yourself in the past might not be available to you anymore. So maybe you enjoyed exercising at the gym, but the gym is closed, or you enjoyed playing tennis, but because the courts are closed, you can't go play tennis. So thinking about how you can take care of yourself in other ways. Next, we're going to have Mary Uter come up and speak about some issues that are specific to healthcare and healthcare workers.
I can see that's all right. Good morning, everybody. I want to welcome you to this webinar and hope that we can help you find better ways to cope with this awful time that we're living in right now. I've worked in a hospital setting in healthcare for well over 30 years in a lot of various positions. And I can assure you that everyone in healthcare right now is just maxed out with this challenge. I talk with people from nursing homes, and it's unbelievable the stress that they're having to deal with their residents passing away, which are like family to them, co-workers getting sick, co-workers quitting. It's really a stressful place, as is like hospice care, home health, all the different agencies with whom we work. I mean, everyone is struggling right now. As Paula pointed out, this disease is unlike anything else anyone's ever experienced. There's a lot of knowledge about it, but in a sense, there's still an awful lot that we don't know. So fear is the result of the unknown and unpredictability. We can't really predict what's going to happen or who's going to be affected. And with that unpredictability becomes a lot of fear. That's across the board with everyone in healthcare right now. You may feel as though there's danger everywhere. And in a sense, that is true. The analogy that I like to use is the analogy of being in traffic, coming from Denham Springs to the city or Prairieville to the city, driving into work. On a good day, you can predict what's going to happen. There'll be lines, there'll be, delays in traffic, but not really a lot of fear involved in that. If you add bad weather, then the fear increases. If you add construction and unpredictability of where's that next pothole or when does this lane shift, then there's another sense of unpredictability and fear. So that's kind of what people in healthcare are dealing with right now. The external events are the same, but your interaction with this illness is unique to you, and the degree of danger varies greatly. And the reality is, I hate to be dark on a beautiful day like today, but we will lose people. We will lose coworkers, family. It's going to happen. I was notified right before this that a longtime member of the Baton Rouge General family, one of our respiratory therapists, succumbed to this illness this morning. And it's a devastating thing. One of his coworkers said he was always the sunshine and never the rain. And I think that's a beautiful way to think about him. So that's the reality we're in right now. We don't know who is going to be the one to get this. We just don't know. So again, knowledge is power. And the more we know about how to protect ourselves, the safer we will be. I know you've seen it drilled into you from TV, from the news, from your people with whom you work, your infection control people, the importance of hand washing, social distancing, wearing a mask, cleaning down your areas. There are a lot of things that we have the knowledge to do to protect ourselves from a lot of this dreaded illness. Again, knowledge is power, and the more you know about how to protect yourself, the more you can reduce the fear. Regarding patient safety, your safety, and your family's safety, there's a conflict often with keeping your patients safe, keeping yourself safe, your coworkers safe, and then returning home to your family. I know a lot of people in our healthcare fields that have sent their children away to live with other family members, live with their parents, grandparents, in another town where this illness is not as rampant. Kind of like during World War II in London. London was getting bombed all the time, and there was a huge movement to relocate children out into the country. They had trains that they'd put them on. I remember seeing that in archival footage. So that's kind of what some people are having to do. And you think about it, it's like you work all day and it's like a pleasure to go home and see your children and see some reality and some fun things, and they've drawn you a picture and stuff like that. You don't have that right now. Your children are gone and you miss them. So that's one of your methods of coping that's not available to you anymore. But again, knowledge is power over the fear, and we have learned what is effective. We have learned how to protect ourselves as best we can, and all we can do is do our best. It's kind of like we just don't know who the next one is going to be, but you can take steps to protect yourself. I know agencies and different companies and administrators of nursing homes, everyone is on board with doing the very best that they can to keep everybody safe. I think there's a sense of guilt that is accompanied by not getting this illness. There's a sense of guilt that some coworkers may feel if they are lucky enough to be able to do their job effectively from a home setting. You hear that others are struggling, and there's a sense of guilt that you may feel. But I think it's important to recognize that each one of us is just part of a team, and we do our best based on what our capabilities are no matter how big or how small that may be. It's a part of the team, and it's a part of moving everything forward. Lastly, well, before I want to get to that last point, I want to highlight one of the benefits of a crisis. I remember when I was really young, I told my mother, and it was after like Betsy or Audrey, one of those really old and massive hurricanes. I remember telling my mother, I know why God made hurricanes. It was so everybody could get together and talk with each other. Because I remember standing out in the street, seeing neighbors I had would never see on a regular basis. So even as a child, I'd recognize the fact that crisis can bring people together. It can separate, but if you focus on, unification against a common aggressor, I guess we'd call it, it can really develop teamwork. If you've ever been in an emergency room or in an intensive care unit or any unit where there's always a crisis, you will see the best teamwork ever. Everyone shares the patients. There's no, this is my patient, oh no, this is your patient. That's just not an issue. Every patient is everyone's. So teamwork is a beautiful benefit of a crisis, and it's, I think, important for us to focus on that right now. And lastly, and I think most importantly, is the need for everyone to have somebody with whom they can speak about their feelings. I think it's best that this is done real time, like shortly after an event occurs. Say, for example, the death of our coworker today. I am sure that his coworkers are reaching out to someone to be able to talk about it and not bottle up their feelings about it. It's very important that you do that. If you do not have the opportunity to debrief, as Paula alluded to earlier, that's where drinking comes in, drug use, depression, suicide, suicidal gestures. All of these negative behaviors can develop if you don't have somebody with whom you can talk. It may be up to you to find someone. It can be your coworker, your arm-to-arm, shoulder-to-shoulder coworker. It may be your unit social worker or your hospice social worker, your home health social worker, your direct supervisor, all the way up to administrator. Find someone with whom you can speak about your feelings. You need to have the opportunity to talk about what happened, play by play, just kind of paint a picture of it, and know that it's safe to do that. That's really the best way to come out of this okay. So I would encourage all of you to talk and then talk some more to get through this. Paula?
So that is it for our part. Now Stephanie is going to talk about some of the signs and symptoms of stress.
Thank you. Thank you, Paula and Mary. As Paula said earlier, I'm Stephanie Sterling, and I am the Department Director for Maternity, Adoption, and Behavioral Health Services at Catholic Charities of the Diocese of Baton Rouge. So now we're going to talk about signs and symptoms of stress. So if we know the signs and symptoms, we'll be able to better address them. And sometimes it's difficult to recognize the symptoms in ourselves. So sometimes we have to recognize them for other people that we're close to. But some of the physical symptoms are maybe headaches, backaches, stomach aches. I know for a lot of people, they say they get a pit in their stomach when they're stressed. I know that I do. Maybe even short of breath. That was something that happened to me several weeks back, probably a couple of months now, when we first started the stay at home and working from home, that there was a lot of anxiety, a lot of tasks that were took up a lot of time. And, there was a week or so that I felt like I could not breathe. I could not catch my breath. And a colleague of mine recognized that in me and, asked if she could help in some way. And that was extremely helpful to me. And it definitely helped me to catch my breath and get some perspective on the situation. Some other physical symptoms might be like changes in weight. So, weight loss or weight gain. And also other times people may not be taking care of themselves as well. So they may, stop showering. They may stop getting out of bed, or really just a deterioration in their appearance. Some other mental and emotional symptoms might be irritability, like a really short fuse. Something that I know we see in a lot of people, like Paula was talking about earlier, when you're in the old downstairs part of your brain, that you're very irritable, could be very short. You can't really access the more rational thinking part of your brain. And I think that is a way that a lot of people, experience mental and emotional stress. Also, depression, anxiety, irrational fears, crying spells. And also, if you lose your sense of humor. So some people, it may not find something funny that you might have normally found funny. And nothing really but is funny anymore to you. Another aspect of signs and symptoms of stress would be behavioral. Sleep, as Paula mentioned earlier, is a big one of behavioral, a behavioral sign, because many people, when under stress, they lose a lot of sleep. They may not be able to go to sleep, and so they're up half the night trying to get to sleep, or they get to sleep, but then after about 3 or 4 hours, they wake up and they can't get back to sleep. Excessiveness, like both Mary and Paula have mentioned, excessiveness of any kind, excessive eating or drinking or gambling or exercising, you can be excessive shopping, anything, just increased excessiveness is another behavioral change that you might see. And also withdrawing from friends and family. And so that's a particularly difficult one at this time, because we are pretty much required to physically withdraw from friends and family at this time. So the next we'll be talking about strategies and how we can find ways to connect with others and be more intentional with the way that we are interacting with others and connecting with others. Here are some strategies that we and other researchers have found effective in dealing with stress and anxiety, especially during this COVID crisis. Many people are finding new ways to connect with others. And because of the social distancing, we have to be really creative and maybe do things that we hadn't done before. One thing that I can think of, or a few things that I can think of, is maybe FaceTiming friends. And, if you were somebody who is pretty social and you used to get together with friends for lunch or dinner or exercising or hanging out, then you could FaceTime that friend and maybe have a social hour. And maybe even, on the weekend or on a day off, you could have lunch through FaceTime with that person. Or, even with family. So many of us are unable to connect with our parents or grandparents or extended family members, siblings. And with that, I would suggest maybe having a Zoom meeting. Something that we've instituted in our family is having a Zoom meeting once a week with our extended family. So it's really nice to be able to see nieces and nephews that live out of state, we actually are a little bit more connected than we were before, because it's something we weren't doing before, is having a regular meeting where we could see family members that we don't normally get to see. And just really, it allows us to lay eyes on another person as well, and be able to check in on them and make sure that they're doing okay, or how they're doing, especially those who live alone, because those who live alone are particularly vulnerable at this time, because they don't have other people who are they're engaged with on a daily basis during the stay-at-home order. So checking in on those folks would be really helpful to them. Another way that we found to be fun during this time is to maybe have a game that you play. A lot of people like to play board games and different trivia games. And one that we found that's kind of fun is the trivia game that's online that's called Kahoot. And they have all kinds of different trivia topics that you can choose from. You can choose anything that you could ever imagine, and then set up a game with other people. And all you have to do is set that up and send the other people the link to the game. And whoever answers the most questions in the least amount of time wins the game. And so it keeps track of those trivia games, and you get points. And so those people who are competitive and like games, that could be something you could play with others, and you don't even have to be together to do that. Another thing that I think is really important is to create a self-care menu. So I think self-care is one of those words that we use very often, and so sometimes it kind of loses its meaning. But there are lots and lots of different ways to experience or take care of ourselves. I would suggest that people go online and look up self-care menu, and you will find lists and lists and lists of things that you can do to take care of yourself, like take a hot bath, or take a walk, call a friend, go fishing, build something, paint something, exercise. There's so many things. Take deep breaths, meditate. There's just countless things that you could choose from, and what works for me might not work for you. So it's important to develop a menu for yourself that is helpful to you. So I would suggest maybe getting a piece of paper and maybe trying something new each week, because now we kind of have to think outside of the box of things that we used to be able to do to take care of ourselves might not be available to us right now. So thinking outside the box and being able to try something new once a week, and you never know, you might be able to find something fun that you never thought of. And in line with that, I think, is spending time outside. Outside is just, right now, the weather is so beautiful that we could take advantage of this weather and maybe take a walk or a bike ride, or just sit outside in the sunshine and maybe get a little bit of vitamin D and fresh air. And, if after you get off of work, maybe taking a time to spend some time outside if you can, if it's safe for you to do so, might be helpful in just changing the scenery, gaining some, perspective, and a little bit of distance from all the things that you've been going through while you're working with patients. Another way we can take care of ourselves is through recreation. And a lot of us don't give ourselves permission to have fun and to play. So we think play is for kids, and really it's not. There's a lot of research about the importance of play. Dr. Stuart Brown with the National Institute for Play is someone who did a study on men who were mass murderers. And their study discovered that those men who were mass murderers and had these mass shootings had a lack of play in their childhood. That was the one thing that all of those men had in common. So it brings us to the point of recognizing the importance of play and having fun. And much of what we learn about play is we learn from animals. So if you've ever watched Nat Geo Wild on TV, you'll see, animals that take time for play, they take time, to work and to gather their food and to eat and to rest, but they also take time for play. And we can learn a lot from that. Um, One thing, if you know me, you know that I don't watch a lot of media. And and that's on purpose. I only watch something if I really want to know what's going on in the world. And I try not to watch too much of it. I actually just try to read about it so that I can control what I take in. So if I'm reading something and it doesn't appeal to me or I've really had enough of it, I can stop at any time. So I would just suggest that people think about moderating their intake of media coverage because too much of anything causes a lot of anxiety. I know when all this started, I was watching a lot of media, which I don't normally do, and it was really causing anxiety in me. And I was just, pacing and not myself. And so after a little while of that, I realized, okay, I had enough. I don't need to keep looking at it and searching and looking and looking and looking because it's not healthy. And so just taking a break from the media coverage and being able to, find what works for you. If a little bit is enough for you, then just, take in a little bit. Right now, we have so much coming at us, with, phones and TVs and computers and just tablets. We can get that, media from so many different sources now that it's really hard to figure out where to turn for good media coverage. And I would just encourage you to, limit that as much as you can. Know enough to keep yourself safe and healthy. But beyond that, it gets a little too much anxiety provoking. Another thing that is helpful to a lot of people is prayer and spirituality. So a lot of people find comfort in their faith and in prayer, and some prayer is even meditative. So if that's something that helps you or is something that you rely on for comfort and for calm, then most certainly bring that back on the table for yourself so that you can continue to receive comfort and calm from prayer and from faith. Like Paula said earlier, acknowledging and celebrating the work accomplished is so important because there's so much that we can't control, and there's so much that we feel like is not an accomplishment or a goal that we've been able to achieve. So even the small things, I encourage you to celebrate the small things, especially with your coworkers and your colleagues, so that there's a shared joy and a shared celebration for that. And ask for help when you feel overwhelmed. And that's very difficult for many of us to ask for help. So it may be easier to try and check on other people and see if they need help. Because if enough people do that, then those who really need help will get the help that they need. If we can just keep an eye on others and see how we might be helpful to them. And if we do need help ourselves, that's really normal during this time. So, if your company has an EAP, I would encourage you to look into that EAP and see how the EAP might be helpful to you or your family. Lastly, we, in this era of internet and apps, we have developed a list of apps that might be helpful for wellness and for calm and in a decrease in stress. And a few of them we have tried ourselves. So Calm is one, Insight Timer is another one, and Sanvelo is another one. There are also lots of fitness apps too, but some of the ones up toward the bottom help with sleep and relaxation, and also giving you really helpful techniques on how to reduce stress and anxiety. One of them in particular, Calm, has some bedtime stories. So some people might find it helpful to go to sleep to having a bedtime story read to you. So just check them out if you're interested, and it might be something that anybody can do, and they all are free, so you don't have to purchase them. We can now take questions in the chat, but before we do so, I just wanted to let you know if you are a social worker and would like a continuing education credit, we have applied for CEUs, and if it is approved, which we think it will be, we can provide that certificate to you for the hour. And we also, in the chat, have posted a link to an evaluation. So if you do want to get a CEU, please fill out the evaluation in the chat. And if you don't want to get a CEU, please still fill out the evaluation so we can always improve or know what's helpful to you in our presentations.
Well, and so now we're going to open it up to questions. If you have any questions, if you want to put your question in the chat box. Stephanie, when you were talking, one of the things that came to my mind when you were talking about the importance of play, one of the things that happens when we're playing is that we start laughing. And when we're laughing, oxytocin is released. And oxytocin is that bonding hormone. So that is another way that we can strengthen the bonds within our family groups and within our coworker groups. And the other thing that I like about the Calm app with the bedtime stories is for people who find themselves having racing thoughts at bedtime and they can't quiet their mind, listening to a bedtime story gives you something else to focus on so that your mind does shut down so that you can go to sleep. So just a few little things that came to my mind as you were talking. So do we have any questions?
I don't see any questions, but to let people know how to enter the questions into the chat box, there's a bar in the middle of your screen, a little menu bar with a conversation. It's a little cloud icon towards the right side of that bar, third from the right, and you can click in that and write a question, and we'll be able to see the question.
Yeah. Mary is going to has something else.
I just wanted to tell y'all about the Calm app and the bedtime stories. I listen to one every night. And if you happen to get the app today and would like to listen to a bedtime story, I highly recommend Rumpelstiltskin Learns to Meditate. Release that oxytocin, Paula. And it's basically teaching you how your life can be improved if you do some deep breathing. And really, that's all Rumpelstiltskin needed. He needed to learn how to deep breathe and relax a bit and chill. So I highly recommend it.
Okay. So I don't see any questions in the chat. Please feel free to, again, please do use the link to send us your thoughts and your evaluation. Also on there, you can, at the bottom of it, you can write in text as to, what might have been helpful or what you might want to see in the future, any kind of future presentation topics that you might be interested in. Well, we thank you all for joining, and we hope you have a great day, and we hope that this has been helpful to you.
All right. Thank you. Have a good day.
Bye-bye.